Okay, what does the sugar industry have to say about all of this? Obviously, not good things. Here's what they say. Fructose for glucose exchange studies show no significant difference. This is a weight issue here, and here's lipids down here. And you'll notice, fructose for glucose, right on the identity line. Indeed, that is true here. But there's 3 problems with this. Number 1, oral fructose is absorbed poorly. When you take fructose alone, it actually makes your GI system really unhappy because you need the glucose as well in order to engage the normal facilitated transport of the gut. In fact, when you take oral fructose alone, it all ends up in your stool because you can't absorb it. So you're not getting it. DNO, that's de novo lipogenesis, that's the making of fat in the liver. 5% of fructose goes to DNL when you're a normal patient in the fasting state. But if you're an obese insulin-resistant person and you're in the fed state, 25% goes to liver fat. Whole big difference. So it depends on which patient's eating the fructose. And the people who are eating the fructose are the obese insulin-resistant people, and they're already fed. And it's not fructose for glucose because there's no fructose alone in nature. Fructose alone is something you make in a lab. Everywhere it's sucrose or HFCS. There is no fructose alone in nature. It's fructose and glucose. And this shows that when you look at DNL, that is the liver fat making, here's glucose alone, here's fructose alone, no problem. Now do fructose and glucose together, you triple it, double the amount, and you 6 times it. There's no asymptote. In other words, when you eat sugar, you get liver fat. So, hell with it. Number 2, fructose does not raise the blood sugar. It has a low glycemic index. There is a scientist down in Australia who says that sugar is fine because it has low glycemic index. And she puts glycemic index labels on foods there because they get money for it. It's a method, like the AHA did and Sunbeam did. Anyway, the bottom line is the glycemic index has nothing to do with this. It's all taken up by the liver and causes insulin resistance. Yeah, it doesn't raise your blood glucose. Who cares? It's making your liver sick. It's a different phenomenon. And a fructose receptor has actually been identified on beta cells. When you get a fructose level, that means your liver's been overwhelmed, and then you do release extra insulin, which is bad. A little fructose has been shown to improve insulin secretion, but like alcohol, it's dose dependent. When you go above a certain level, then you start getting into the problem where that's not the case. It's all about dose. Information on total sugars is available on the food label for everybody to make their own decisions. Garbage. Here's why. The Nutrition Labeling and Education Act of 1990 lists total sugars, total. That's in glucose, galactose, fructose, and all of their congeners. There's no information on added sugars. And I'm not really concerned about naturally occurring sugar. I'm not concerned about the fruit. Remember, the fruit was a wash in our diet and diabetes study because it had fiber. So I don't care what comes with the food normally. All food is inherently good. It's what we do to the food that's not. So what you want to know is what did they add? Point is, they won't tell you what they added. And the reason is because the food industry made it so. Because they said that the information was proprietary. Because if they put the amount of added sugar on the label, then their competitors could duplicate their recipes. This was proprietary, and we can't know it. And you know what the FDA said? They said, okay. And so for 22 years now, we've basically been eating what we don't know. Okay? And only 57% of the people even look at the food label. Is there even anything on the label even worth knowing? Finally, most important, regulation is tantamount to the nanny state. I have been called the worst things. I have been called a puritanical Nazi communist. I have no idea how you can be a Nazi and a communist at the same time. Okay? Because I think we have a problem here. Okay? And they're saying, stay out of my kitchen, don't tell me what to eat, etc., etc. The point is we're already told what to eat. Because the food industry's told us what to eat. Because 80% of the 600,000 food items in America today have added sugar. And the food industry put it there, because how else did it get added? The point is we've already been told what to eat. We already have the nanny state. The difference is, it wasn't your nanny that told you. It was the food industry. That's the difference. And finally, who's winning the war? They are making money hand over fist. This is the S&P 500 here. This is the economic downturn of 2008 right here. And here's McDonald's, Coke, and Pepsi doing very well, thank you. And here is Archer Daniels Midland, Monsanto, Hormel, General Mills, ConAgra, Procter & Gamble, and Kraft, all above the S&P 500. Bottom line, you want to make some money, invest in a food company because they are doing very well. And they don't want this juggernaut to stop. There is no impetus for them to change. Okay, what can we do? All right, so we have this thing here called Let's Move. All right? Focus on the individual, focus on the family, and focus on the community. No focus on government and no focus on the food industry, indeed. How come? You tell me.
It's an election.
Yeah. The point is, I don't think our toxic environment can be changed without governmental or societal intervention, especially when there are potentially addictive substances involved. We haven't been able to do it for any other substance of abuse. What makes you think we'll be able to do it for this either? Take a look at all these diseases. Once upon a time, every one of these was personal responsibility until we realized they weren't. Okay? Now, we have programs for every single one of these. Teen pregnancy. Is teen pregnancy personal responsibility? Well, we treat it like a public health issue, indeed. Pollution, AIDS, right? To Chick Coop's credit, he recognized that this was a public health problem, irrelevant to whether or not there was a personal responsibility issue or not. Point is that every public health problem needs government. So you can have it one of two ways. You can have it as targeted prevention with strengths and weaknesses. Here are the strengths. It's individual, so it's targeted to the person who needs it, limited to those who are affected, easier to incorporate into medical care, that's true. And there's a good benefit to risk ratio, if it worked. Weaknesses, medicalization of prevention, very hard to do. Behavior modification, forget it. There is no behavior modification. Okay? And if you don't understand that, we can talk about it after. There is no behavior modification. There's only environmental modification. Costs and feasibility are very high, and you got to identify the people, and it has extraordinarily limited success across the board. Public health prevention, on the other hand, radical, powerful, works. Environmental modification, we've got an environmental problem, you can fix it. Limitations. Who's going to allow it, right? Keep your hands out of my kitchen. Feasibility, could we actually regulate sugar? Is it possible? Could we actually limit consumption across the board? And costs. The target, not just the obese. Remember, it's non-communicable disease. Forget obesity. Throw obesity out. Obesity is a non-starter. Here's why. Assume an adult US population of 240 million with 30% obese. Here's what you need to know. 80% of those obese people have metabolic dysfunction. They're the target. So take 0.8 times 0.3 times 240 million, that's 57 million people. What you don't know is that 40% of you sitting here in the room right now have that same metabolic dysfunction, you're just not obese. You have hyperlipidemia, you have heart disease, you have diabetes, you're just not fat. Because obesity is not the cause of those diseases, it's a marker for the metabolic dysfunction, and the metabolic dysfunction causes these other diseases as well. So there are plenty of people who are thin who have this problem. So 40% times 0.7 times 240 million, there's 67, so that's 124 million, it's more than half of the population. So you want to talk public health? Let's talk public health. We're talking about more than half of the US population who needs help. Why is alcohol so relevant? Well, as I told you before, they're both nutrients, but aside from energy, they have no health value. Metabolic and CNS pathways are similar, especially in the liver. Both are legal substances that produce health harms when overused, so we limit their consumption in various ways. There's little danger from moderate consumption. The problem is, how do you make sugar consumption moderate? And the burden of harm falls disproportionately on the poorest people. Why? Because they're the ones who need the most pleasure. Here are the strategies that don't work. Government guidelines do not work. Public information campaigns do not work. Ask the New York City Department of Health. I love their YouTube. Everybody see their man drinking fat commercial? It is disgusting. It's great. Okay, but does it work? No. Warning labels on product packaging. Okay? Did that work for cigarettes? Nope. What worked for cigarettes? Two things. Secondhand smoke, right, which affected other people, and what else worked?
Taxes.
Well, taxes, but why were we able to put taxes in? What worked? The documents, corporate malfeasance. That's what worked. Okay? School-based education programs, do they work? Not very well. The data on school education is not very good. And menu labeling, I'm going to show you that right now. So here's the New York City menu labeling that occurred just recently. So there are two of them. There's the START cross-sectional study at 2007-2009. The mean calories did not change. 3 major chains showed small decreases of 50 calories. 15% of the respondents said they reported using the calorie information. Those that did consumed 106 fewer calories at that meal, 15%. That means 85% of people increased their calories. So does it work for the population? Not really. How about for kids? 349 children, 69% accompanied by parent, 90% from lower SES groups. No statistical significance before or after labeling. 35% ate fast food almost once a day. 7% noticed the labels themselves. 9 said they considered the information when ordering. 72% said that taste was the most important factor. That's why they're there. What do you think the label's going to do? Okay, how about things that might work? Controls on advertising and marketing. God knows, marketing to kids is absolutely, unbelievably immoral because an 8-year-old can't tell the difference between a TV commercial and the show. How can you market to them? Okay? Counter-advertising campaigns, right? The man drinking fat. And industry self-regulation. I love that one. Here, that's what's going on, right? In Istanbul in 2007, 52 European health ministers got together and agreed to cease marketing of junk foods to children in Europe. In 2007, at the Childhood Obesity Conference, I cornered Federal Communications Commissioner Deborah Taylor Tate and asked her what the U.S. was going to do. Her response, I expect the food industry to police itself. Now, that was the previous administration, but nothing has happened in this administration to change that. The Corn Refiners Association has, of course, rebranded HFCS as corn sugar without FDA approval, yet that's what's out there, okay? Even though the FDA said no, that's what they're advertising. We, out on the left coast, banned toys in Happy Meals. After that, 3 states banned toy bans. And finally, the campaign to retire Ronald, which continues to this day. How about strategies that are likely to work? Pricing strategies are likely to work, okay? Hit them where they live. Controls at the point of sales, restricting access. Bundling strategies, putting them together. And ultimately, government agency action. Okay, let's do soda taxes. Kelly, you can break in anytime you want. Canada and Europe already have this. They already have GSTs and VATs for this. Price elasticity on a can of soda is very large. A 10% price increase reduces consumption by a total of 2%. Not very good. And that actually comes from here. Existing taxes on soda, this is from Fletcher, this is from Yale right here. Existing taxes on soda, which right now average 3%, do not result in a reduction in soda consumption or in obesity rates. So we'd have to go way higher. The question is, how much higher? Small taxes do generate money for programs. For instance, a penny an ounce would be worth about $14 billion nationwide. The question is, would it actually reduce consumption? Not clear. Sturm, who works for the Rand Corporation as an economist, modeled this and said we'd have to double the price of soda. We'd have to make it a $2 can in order to actually reduce consumption. And this is actually similar to what happened with tobacco and ethanol. Now, nobody ever thought that a $12 pack of cigarettes could fly. But that's what it costs in New York City today to buy a pack of cigarettes. The point is, you want it to hurt because you want it to hurt. That's the point. Differential subsidization. You could subsidize one thing and tax another. You could modify behavior through pricing. For instance, the Nordic countries do this. They subsidize low alcohol beer and tax hard spirits in an attempt to try to keep alcohol consumption down. And they do this very effectively. And they also have state liquor stores, so the price is the same everywhere. You could discount diet soda and tax sugared soda to get people to drink diet soda. Now, I'm not advocating diet soda. That's not the point. Okay, it's not even clear that this would help because diet soda consumption is also at least correlated, if not causative, of metabolic syndrome. And there's still the issue of juice, which I think is public enemy number one as a pediatrician. The iron law of alcohol policy, the unbreakable law, is that reducing the availability of alcohol will reduce consumption, will reduce alcohol-related health harms. You cannot get away from that. Well, the same would be true with sugar. If we reduce consumption, we could reduce health harms. The only question is, what would we substitute instead? And that's a big question, and I recognize that. Addiction transfer. You know, when you stop smoking, you start eating, right? When we got rid of the fat, we added the sugar. Well, what if we got rid of the sugar? What would we add instead? Okay, this is an important question, and we need to think this out. Restriction, controls at the point of sales. How about age limits on purchase and use? Why is it that there is a convenience store within 500 feet of every single school in America? Because the children are a target, that's why. Licensing and zoning controls on sales outlets. We could do that, we did it for alcohol. Permits that control hours of operation. What if they couldn't sell sodas between the hours of 7 and 9 in the morning when kids are going to school and from 2 to 5 when kids are coming home from school? They could get it any other time, or parents could buy the sodas for the kids if they really want to have them. And we have SB 19 out in California, sodas out of schools. The last survey in 2010 says that obesity rates have remained stable in California, which is very good. So there might be some value to that. Now, this says that you got to do it right. So this is a study that just came out 3 weeks ago. And what it looks at is no policy versus ban soda only versus ban all sugar sweetened beverages in schools in 12 states. And what it shows is that the purchasing goes down, but the consumption does not. In other words, they're not getting it at school, they're getting it at home. So how much we can do with schools if it's still in the home is a real question. So restriction of access means restriction of access. It doesn't just mean restriction of access in schools. And government agency action. Regulation of the food industry by Congress is a complete non-starter because everybody in Congress is bought off already. Why can't the Farm Bill subsidize real food instead of food ingredients? What was the Farm Bill? The Farm Bill was invented back in the early 1930s because of the Dust Bowl. Okay? We needed to feed a hungry population. We had people in the Depression, and we had farmers going out of business. So what did we do? We subsidized something called commodities. So what is a commodity? It is storable food, right? Joseph and Pharaoh, right? What did Pharaoh store for the 7 years of famine? He stored grain, because grain is a commodity. You can dry it, you can save it, you can store it, you can use it later, you can ship it around. Do we need that today? Is that necessary? Do we need commodities? Do we need to be subsidizing commodities? Do we need to be subsidizing corn and soy? Is that necessary? We could actually subsidize broccoli, and it would work perfectly fine. We could do that, and that would be a whole lot better, okay, despite what Scalia said. Okay? Currently, the U.S. Department of Agriculture does not list a dietary reference intake for sugar. There is no upper limit. There's no lower limit either. There's basically whatever the hell you want to do. Food stamps. Remember, Mayor Bloomberg tried to get sugar sweetened beverages off of food stamps, the Supplemental Nutrition Assistance Program, and he was rebuffed by the USDA. Several other states have since recently applied, which is interesting. We'll see what happens. The question is, why is the USDA in charge? Their job is to sell food. Their job is to protect the food supply, and that includes protecting it from people like me. Point is, this is the fox in charge of the hen house. Why is the USDA involved in our health at all? I don't understand why HHS is not involved. In fact, I don't even think HHS should be. I mean, there's got to be a better way to do this. The FDA and the European Food Safety Administration could influence the court of public opinion. They could help to make sugar less appealing, as they did with tobacco. Cigarettes went from fashion to filthy habit in just a few years. The FDA could revisit the Nutrition Labeling and Education Act, and instead of total contents, we could have the degree of processing listed, like what was added and what was taken away. because all food is inherently good. It's what you do to the food that's not, and then people can make their own choice. This food is too processed, this food is not processed, etc. The FDA could re-examine the 1986 disposition on sugar and consider removing it from the GRAS list, because when that study was done, when that report came out, we didn't have high fructose corn syrup. We didn't have this glut. We didn't have the doubling in total sugar consumption like we do now. The problems with that document: they were based on 1978 surveys before HFCS. The mean consumption was 53 grams. Now it's way higher. That was for all sugars. Now it's 100. 90th percentile was 104 grams. So divide by 2 for fructose. We were at the toxicity level of 50 grams a day. Now we're way up, over it. There's no data on excessive consumption. There's no data on HFCS. And fruit juice was considered a fruit. And it needs to be considered sugar. The current White House and FDA are not interested, and have said so after the Nature article. I would leave you with this. I'm about to close. This is a statement that came out of an Indian public health forum, and I subscribe to it, and maybe you will too. It states, all significant advances in population health require and involve the use of law. Indeed. Think back. Everything. HIV, tuberculosis, lead poisoning, you name it. Somehow the judicial system got involved, and had to. It was necessary. They are the only branch of government that currently is not co-opted. Ultimately, I think that's where this is going to go. I think that we need to get it there. And the way to get it there is to influence the court of public opinion, which is why I'm standing here and talking to you today. And hopefully I've influenced you in a way that will help you be activists for your own families and hopefully for public health concerns as well. For further reading, whole bunches of papers. I can supply these to the Rudd Center, and they can distribute for you. These also just came out recently. This one here, this one. Okay, this is actually quite good with a lot of science for those of you scientists. And ultimately in 2013, as Kelly told you, Fat Chance, Beating the Odds Against Sugar, Processed Food, Obesity, and Disease, will be out January 2013, Viking Penguin. My collaborators at UCSF, Weight Assessment for Teen and Child Health, all of my colleagues at Touro University, and also our CTSI. Jean-Marc Schwartz is a card-carrying fructose biochemist who vetted all of the biochemistry that I did not show you today. And also my colleagues at the Institute for Health Policy Studies, where we are thinking about how to address non-communicable disease globally as we speak right now. With that, I will thank you very much for your attention.